Dr. Elizabeth Mandeville. She currently works as a general practitioner and public health specialist. Graduated with merit after doing postgrad degree in public health and have systems management at the University of Liverpool. And she's also a member at the Eastland Seventh-day Adventist Church. A nice lady, humble lady, and I'm going to ask her now to come. Put your hands together. As she comes and she speaks to us on cervical and breast cancer. And at the end, you'll be able to have a few minutes to ask any questions. So welcome.
Hi, good night, everyone. And I want to thank the Cumberbatch brothers for inviting me to speak tonight. And I hope that you do learn something from this presentation. Now, cervical and breast cancer, sometimes these can be sensitive areas to talk about. So I want y'all to feel free to ask me anything that might be unclear throughout the presentation. You can ask me in between. You don't have to wait to the end, but if you prefer to wait to the end, that's fine as well. Right, so why is cervical and breast cancer important? Now, in Barbados, we have a Barbados National Registry, and this is a surveillance system that tends to take all the cases of cancer, stroke, heart disease, and some other illnesses as well. And they usually take this information and they do several different studies. And in 2015, they had indicated that breast, uterus, and cervical cancers were the leading cause of death in women. They actually accounted for 49% of all cancer deaths. And I just wanted to mention as well, 48% of the deaths in men were due to prostate cancer. So the lecture tomorrow night will be very good to listen to as well. Right. So this information was taken from the World Health Organization in 2017, because obviously this is still 2018, so we wouldn't have that information as yet. But I wanted to let you all see on the left-hand side, my left, your right, it looks at the females. And in red, that is the percentage of breast cancer cases in 2017. Under that was the colorectal, and then the uterus was in green, lymphomas and multiple myeloma, those are some blood cancers, are in orange, and then the cervix is in gray. The other cancers like respiratory, etc., those are blue. And I just wanted to mention for the males, the red is the prostate. So you realize that in men, 35% of cases of cancer were actually the prostate cancer. Right, so this just showed some more data. Also in Barbados, last year there were 207 cases of breast cancer and 44 cases of cervical cancer. And this just, the next slide shows the trend of cancer. Most people will say that it's pretty much stable. There's a slight decrease over the years, but as you can see, it has been between 20 to 40 deaths per 100,000 persons. So we're going to talk about cervical cancer now. Now, the awareness month for cervical cancer is in January, and I think you all know breast cancer, their awareness month is in October. Excellent, excellent. Some people knew that already. Right, so, even though cervical cancer is 95% preventable, there's still several cases within the Caribbean and Latin America. Now, you probably heard of Dr. Chatrani. He's a very vocal person with cervical cancer and cervical disease, and he usually has a walk every year in aid of this. He also said it requires widespread awareness, increased screening, and effective prevention and control. It was disclosed that the Caribbean was among the top 4 subregions in the world with respect to the incidence of cervical cancer, and they also had the highest burden of the human papillomavirus, which is usually the cause of cervical cancer. So what exactly is cervical cancer? This is a malignant neoplasm of the cervical area. Now you're probably wondering, where exactly is the cervix? So this is the anatomy of a female. The vagina is at the bottom. The middle part is the uterus. That's where, as you know, babies are formed. The ovaries, there are 2 at either side in the gray, and the fallopian tubes or uterine tubes are at the side. The cervix is actually the neck of the womb. So where you see the word external os, that's where the cervix is located. And the cervix has 2 main sections. The endocervix is inside, and the ectocervix is on the outside. So the vagina actually, the ectocervix protrudes into the vagina, and the endocervix goes into the womb or the uterus. Now, the next picture shows, a lot of pictures are going to be graphic. I should have warned you from the beginning. This is what cervical cancer looks like. So when persons, they go and they get the pap smears done, sometimes we see this when we look. Sometimes they have to get it, well, it's shown up a bit better when they do the colposcopy as well. Right, so I just wanted to explain why cervical cancer occurs. Now, if you notice in the blue, the cells of the uterus are actually columnar, right? They look like columns. Well, the cells of the vagina are something called squamous cells. Squamous cells are actually the skin. So you can see the columnar cells and the squamous cells, they meet at what we call the transformation zone. Now that is a very interesting zone because they have cells with both the columnar and the squamous mixing together. And if you know anything about DNA, each cell has a certain DNA to make it into a particular cell. So in that area, the DNA might go into columnar or it can go into squamous. So sometimes if there's some type of mutation there, if the cells, the DNA isn't working well, because that area, the 2 cells are mixed, that is how you can get cancer. I hope I explained it well. In the picture at the side, it just shows, sorry, you could go back one, a little clearer. The columnar cells you will see are in the center, and the squamous cells are on the outskirts. So you can see, you know, that change there. So that's why cervical cancer is most likely to occur and one of the most prevalent cancers in females. Okay, next. So what is the cause of cervical cancer? So as I mentioned before, the most prominent cause is the human papillomavirus. And persons usually get this human papillomavirus from sexual contact. When that virus enters the body, the virus tends to go to those cells there in that transition zone, because as I said, that's the area where there's a lot of mixing going on and a lot of mutations can occur. When they go there, they can actually infect the DNA in those cells. And once that happens, that's when the cancer forms. Now, the human papillomavirus is a very interesting virus because sometimes our body can actually clear the human papillomavirus. So even though you might get infected with it, your immune system sometimes, if it's very good, can actually fight off the human papillomavirus, and it may not get to the cancer stage. But for some persons, that is not always the case. And there are a lot of risk factors that can cause you to get the cancer. Persons who smoke are at risk for having cancer, cervical cancer. Persons who have sex at a younger age. Now, the reasoning behind that is that if you start having sex young, you're exposed to sex for a longer time period. So you might have more than one partner, which, you know, puts you at risk for having the HPV virus. Also, if you have sex with a person with the HPV, now, unfortunately, men don't get many symptoms. So most men don't even know that they are carriers of the HPV virus. So if you have sex with a person, you may not realize symptoms probably sometimes till like 15 years later as well. Persons who have a family history of cancer are also more prone to having the cervical cancer. Multiple sexual partners. There is more than one serotype of the human papillomavirus. So if you have multiple partners and they have different types of the human papillomavirus, unfortunately the body, you know, as I said, the immune system tries to work, but sometimes it might not be able to fight off all the different viruses. So that also puts you at higher risk. If you have a depressed immune system for obvious reasons, and the use of the oral contraceptive pill, unfortunately, when you use it for a long time, we usually say over 15 years, it puts you at risk for many cancers, including the breast, endometrial, and the cervical cancer. So what are the signs and symptoms? These are extremely vague, and they are not only with cervical cancer. So most of the time, when you have these symptoms, it may not even be cervical cancer. So that's why you really should get a pap smear done. But I'll just show you some of the signs and symptoms that you can get. Abnormal vaginal bleeding, bleeding or pain after sexual intercourse, bleeding after menopause. Usually bleeding after menopause is indicative of endometrial cancer, but you can get cervical cancer as well. Unusual vaginal discharge. Sometimes there's an odor as well when you have the vaginal discharge. Pelvic pain, you usually get that at the later stages. So when you're going into stage 3 to 4, you will start to get the pelvic pain. Weight loss, again, a very vague symptom. Constant fatigue as well, a very vague symptom. So that's why, as I said, it's really necessary that you do the pap smears, because, you know, the symptoms don't always tell you that you may have the cervical cancer. Now, the staging, I just wanted to show you that the cervical cancer, it usually starts, as I said, by the transformation zone or transition zone in the cervix, and that is usually called the carcinoma in situ. It can start to spread, but if it stays within the cervix, then it's only at stage 1. As soon as it starts going to the vagina, but not the pelvis or the other organs, then it's stage 2. When it goes to the pelvic wall or the lower vagina, that's stage 3. And when it starts going to the other organs like the bladder or the rectum, that is stage 4. So how is cervical cancer diagnosed? Now, as I said, we usually always take a history and we do a physical exam. So on physical exam, when we put the speculum in, sometimes when we put it in, we realize that you might see some bleeding. Also, if you touch the speculum, you might see bleeding on touch. Friable means that some of the skin or some of the cells might actually break off. The cervix is also supposed to be mobile. So usually when the doctor puts their hand inside, they try to move to see if it's still moving. If it's hard and not moving, then you know something is wrong. And induration of the cervix just means that it's swollen. Now, the real test to find out if you have cervical cancer is by doing the pap smear. So I usually encourage all women, especially if you're, well, if you're sexually active, you should have a pap smear done. The Ministry of Health usually recommends that you have it done every year if you're at risk for cancer. If 2 of your pap smears come back normal, then you can have the pap smears done every 3 years. Now, I just wanted to show you how the cancer cells look under the microscope. So as I would have told you before, the cells, and if you did biology, the cells all have a nucleus, and that's where the DNA is located. So as the DNA gets infected with the HPV virus, the nucleus, which is the red dot in the middle that's starting to get bigger, when the DNA starts to mutate, you will see the cells also start to mutate. And those are the different stages that it can go through. Now, when a pap smear is done and it comes back showing an abnormal reading, we usually send a person to get a colposcopy done. Now, a colposcopy is just a really large microscope that the gynecologist usually looks down into, and it will show up the cervix. So, as I had shown before, these are some images from a colposcope, where you can see the whole of the cervix is in the center. We usually stain it with vinegar. Vinegar makes the cervix white if you have cancer. And in the first picture, you will see that the person is actually doing a little biopsy of that white area. The second picture is showing an obvious malignant or cancer growth of the cervix. And I just wanted to mention that the HPV virus doesn't only infect the cervix. Males as well can get anal cancer, or females can get anal cancer, and the cancer actually looks similarly to how the second photograph looks by the anus. Now, the treatment is surgical or usually oncological. So a radical hysterectomy, that's where they actually remove the entire cervix, the entire womb. They remove the ligaments next to the womb and part of the vagina as well. That's a major, major surgery. You can also get chemotherapy if the stages are from stage 2B onwards. You can do the chemotherapy, radiation therapy. For the stages 1 and 2, up to 2A, sometimes you can do the cryosurgery, the laser therapy, or the loop, electrosurgical excision procedure. That's where they actually take a loop that is like a scalpel, and it actually cuts the area where the cancer is in the cervix. Right, so the prognosis, as with all cancers, the earlier you can detect the cancer, the better your chances of survival. If you can get the cancer when it's still in situ within the cervix, then you can pretty much be cured, because they can just do some small procedures and with the laser or the cryosurgery, and that should remove the cancer completely. But as you go into the other stages where it starts to affect the pelvis and the other organs, which is the stage 4, then your prognosis is less than 20%. I just wanted to mention the HPV vaccine. They had a very large conference last week, and I was privileged to go to the conference, and they talked about the HPV vaccine and the benefits of it. It's usually given to children who enter secondary school in Barbados. That's around 11. But the vaccine is actually mandated for anyone, both male and female, from 9 to 26. Now, the idea for it being so young is because they hope that at 9, 10, 11, you haven't started having sex as yet. So the vaccine is therefore supposed to prevent you from getting the illness just in case you do get infected with this HPV virus. but you can actually take the vaccine up to 45 years of age, even if you had had a previous diagnosis of cervical cancer, you can still take the vaccine. That's not a contraindication. Now, in Barbados, there are only the 4 serotype vaccine, and that can be given in either 2 doses, 6 months apart, or in 3 doses, at a month after the first one, and then 6 months after the second dose. They, as I said, just launched the 9 serotype vaccine last week. You're probably wondering what are serotypes. Serotypes are the different types of HPV virus. There are 2 main ones that can cause cancer, and there are 2 that cause warts. So that's what the 4 serotype vaccine contains. The 9 serotypes, what they did several studies all over the world, and they found that certain serotypes were more prevalent in Africa and Asia. So they added 5 more serotypes to the 4 serotype vaccine. And I just wanted to mention that since the vaccine was recommended in 2006 in America, they realized that there was a 56% reduction in HPV infections. So the vaccine seems to have been doing its job. Now the ribbon is this ribbon for cervical cancer, and I will go on to talk about breast cancer now. Now, breast cancer is actually the 2nd leading cause of death in the world. It's the 2nd most common cancer in the world. The incidence increases with age. All women are at risk, but some men can actually acquire the breast cancer as well. Now, this was taken from an article this year. If you know the Minister of Education, Sanchia Bradshaw, she recently got diagnosed with breast cancer, and a lot of articles came out subsequent to that. And it said that unfortunately breast cancer still remains the most commonly diagnosed cancer among women in Barbados. The number of new cases diagnosed per year continues to increase, and there was a noticeable increase in younger women below the age of 50. Now, in Barbados, 1 person dies from some type of cancer every week. That is noteworthy. The statistics from the Queen Elizabeth Hospital show that in 2013, there were actually 469 cancer patients, and 101 of them were breast cancer. In 2014, there were 426, 98 of them were breast cancer, and in 2015, there were 430 cases, and 140 of them were breast cancer. So you can see around 1/4 of the patients being diagnosed with cancer are breasts. Now, the World Health Organization, I usually take a lot of my data from them. It showed that the deaths in Barbados had reached 87, or 3.25% of the total deaths just with breast cancer. And Barbados actually has the 3rd highest rank in the world with respect to the breast cancer deaths. So I want to just show you a little bit of the anatomy of the breast. On the outside, you know, there is the nipple, and the areola is the brown or the pinkish part of the breast. And then behind that, you will have the milk ducts and the lobules and the lobe, which, as you know, the breast is really for breastfeeding. So the ducts and the lobules actually are supposed to fill with milk when, you know, you have a baby and it comes through the nipple. The fat tissue is just there to give the breast its shape, and the breast is attached to muscle and the ribs. I just wanted to show you, if the breast tissue started to get infected with cancer, cancer tends to go through fat very quickly. And you realize that bone and muscle is a very thin layer, so breast cancer can actually spread very quickly, just given the anatomy alone. So 5 to 10% of cases of breast cancer are due to genetics. You can actually inherit the gene from your mother or father, and 90% can occur due to aging process or environmental factors. So there are several risk factors for breast cancer. Obviously, gender, women are more prone to getting breast cancer than men. Race, the black race is actually more prone as well. Age, as you get older, you're more prone. If you have a family history of any type of cancer, especially breast cancer, then your risk factor increases. Childbirth. The more children you have, it actually protects you from getting breast cancer, because as I said, the function for breast is actually as a mammary gland to produce milk. So believe it or not, the more children you have actually protects you. Obesity unfortunately causes a lot of problems, and it is a risk factor for breast cancer as well. Diet is a huge risk factor. I'm going to mention diet at the end. I was very glad that Mr. Cumberbatch started with the nutrition. Lack of physical exercise, a history of cancer, any type of cancer. Say you had stomach cancer, then you're actually at risk for having breast cancer as well. And hormone use. As I mentioned, the oral contraceptive pill, and some persons after menopause, they also use hormones as well. All hormone use, you're at risk for the female cancers. So signs to watch out for. I'm going to go through the breast self-exam a little later, but if you feel a lump in the breast, if you see a change to the nipple, some people, they realize that their nipple all of a sudden inverts or something happens, it changes color. If you see a discharge, if it's clear or bloody especially, then that's usually an indication that it's cancer. If you see any sores on the nipple or the areola, that doesn't necessarily mean it's cancer, but you should go to the doctor to get it checked. If you see any lymph nodes under the arm, you should also get it checked, but that does not also mean that it is breast cancer. However, if you do see dimpling of the skin, that is, you know how a dimple looks on your cheek where it seems as though it's pulled in? Right, so if you see a pulling in your breast, you have cancer. Or any sort of skin changes where it literally looks like an orange, then that's an indication of cancer. So the screening for breast cancer includes the self-exams. You should go to your doctor, especially if you're over 40, to get a clinical exam done by a health professional, either a nurse or a doctor. And then there are the mammograms. So the breast self-exam is an opportunity for women to become familiar with their breasts. If you do these exams every month, then you will be able to figure out if there's a change. And you should really start at around 20. If you have a family history of breast cancer, I usually tell persons they need to start screening aggressively from 10 years on to when. So say your mother was diagnosed at 50, then from 40, you really need to start doing some aggressive screening. So when should you do the breast self-exams? This is important. You should actually do it about 5 to 7 days after the start of your period. For those persons who are menstruating. Persons who are menopausal, you just pick a day and you do it the same day every month. Persons who are pregnant, you should still do it. Once again, pick a day and do it the same day every month. It usually takes about 10 minutes, and you should examine the whole breast tissue. Now, some doctors would advise to do it in the shower, because when the water runs, the tissue is much softer, and you're able to slide your hand around the breast a little easier. But you can also do it lying down as well. So you need to put your hand over your head, I usually advise persons to start from the nipple and you go around in a circular motion until you get right under the armpit. And you should feel under the armpit as well. If you're in the shower, same procedure, hand up and you start from the nipple and go right around. And you can also squeeze the nipple as well, only once a month, just to make sure that there is no blood or discharge coming from the nipple. Now, the clinical breast exam is usually performed by a trained doctor or nurse, and we recommend it every year for persons over 40. And persons who are between 20 and 40 who have no risk factors, you can do it every 3 years. And persons who are at high risk, you may need to get it done a little more frequently than every year. The mammogram is simply an X-ray of the breast. It is more used, or it is more beneficial to persons over 50. The reason for this is as you go through changes in life, the breast tissue when it starts out as a teenager is very dense. And as you get older, unfortunately, you will realize that it becomes very flabby. You know, the muscles, and so they get a bit lax. Dense tissue, when you x-ray, it looks white. So it's not easy to pick up cancer, because cancer is supposed to be white as well. So when you do a mammogram of a young person, everything is just white. So that's why the data is a bit mixed on patients between 40 to 49, because sometimes your breast may still be a bit dense. So it might show up a white area, but it may not be cancer. It might just be the tissue that is dense. And I should note that, and I've seen both of these when it was an intern, you can have a lump and go and do a mammogram, and the mammogram shows up nothing, but you have cancer. Or you can have no lump, and you go and do a mammogram, and the mammogram shows up something white, and it's only after you do a invasive guided biopsy, then you realize that you have cancer. So you really should do both the self-exams and the mammograms. Persons who are young, we usually advise you to get ultrasounds because it will show up the cancer a little better than the mammogram. So the treatment for breast cancer is similar to the cervical. You can get surgery, radiation, or chemotherapy. And because breast cancer, for some reason, the estrogen receptors in the lymph nodes sometimes get affected. Sometimes they can use a drug called tamoxifen, which is a chemotherapy drug, but is more hormonal because it targets the estrogen. And the prognosis, once again, if you can get it early, your prognosis is quite high. When you start going in the later stages from stage 2 to 4, the prognosis is not very high. And the ribbon is pink. And as I said, this month is the breast cancer month. And I just wanted to talk a bit about the prevention of cancer. Now, what Mr. Kamabak said, I am in total agreement with the New Start, which is the nutrition, exercise, water, sunshine, temperance, air, rest, and trust in God. If you can do those, that would keep you away from all types of diseases, not just cancer. But in my research, I found some other things that I thought that I would mention. Cut out sugary drinks. Persons who drink a lot, who drink a lot of sugary drinks, they actually increase your risk of endometrial cancer, up to 87% higher risk. Persons who are found to eat more cancer-resistant starches, those are the ground provisions. Green bananas and the Edos, these sweet potato, those ground provisions, they actually reduce the risk of colon cancer. Persons who stand more and sit less, they did a study, and it was found that you're at a 24% higher risk of colon cancer if you sit for most of the day. And there was also another study that showed for persons who sit in front of a TV for a long period during the day, there's a 54% increased risk of colon cancer. Now, you should steam your vegetables. Broccoli is said to be a cancer superfood, and its cousins as well. So all the cruciferous vegetables like the cauliflower, cabbage, those contain something called glucosinolate, and when it's boiled, it actually preserves it a little better. That actually helps to cause tumor cell death, and it can reduce the sizes of tumor. Brazil nuts are also high in selenium, and that also helps to repair cell DNA, and it also helps to cause tumor cell death. Garlic is a very good food as well. It contains allyl sulfur, which promotes the immune system's natural defenses against cancer, and it also helps in your immune system on a general basis. That's why some people, if they have colds and they take garlic, they realize that the symptoms tend to decrease. Now, you should get at least 15 minutes of sun a day. The sun contains vitamin D, and almost 90% of your body's vitamin D comes directly from the sunlight, not from food supplements. And it was shown that persons who have vitamin D deficiency, that actually reduces the communication between cells, so it causes them to start sticking together, and that then can cause the cancer cells to spread more quickly. And people who have lower levels of vitamin D are actually at a higher risk of multiple cancers, including the breast, colon, prostate, ovarian, and stomach. Now, this one I found interesting. You should avoid charring meat. Now, persons who eat burgers or do a lot of grilled food, you know, you like to see it black. Right, well, that apparently creates a compound called a heterocyclic amine, and that is linked to cancer. They damage the DNA, and it is linked to colon, breast, prostate, and cancers of the lymph cells. So, and also eating charred meat regularly can increase pancreatic cancer up to 60%. So you should really try to avoid charring the meat. Eating fish such as salmon tends to help in the anti-inflammatory process, and it also helps to fight the cancer cells. These fish contain the omega-3 fatty acids, and there are also a lot of foods that contain antioxidants. So fruits such as kiwi, grapes, citrus, also carrots, tomatoes, berries, they contain a lot of antioxidants which help to fight against the cancer cells as well. This is also interesting. Research has shown that exposure to light at night may increase the risk of ovarian and breast cancer in women. So you should actually keep your bedroom dark. Light suppresses the normal production of melatonin, and melatonin is a chemical in the brain that regulates the sleep-wake cycle. And it was shown that when this sleep-wake cycle is interrupted, that actually increases the release of estrogen-fueled cancers. And a study showed that breast cancer risk increased among women who didn't sleep during the times when their melanin levels were supposed to be the highest. You should walk for at least 30 minutes a day, as Mr. Kammerbat said. Persons who exercise for at least 30 minutes have a 30 to 40% lower risk of breast cancer. They also said you should avoid dry cleaning. Dry cleaning contains a chemical called perchloroethylene, and that is linked to both kidney and liver cancer. You should cut out the fries and the chips. Now, When you fry foods, it can actually produce a compound called acrylamide, which can cause cancer. And it was also shown that persons who use more calcium, so if you have at least 700 milligrams of calcium in your diet, you have a 45 reduced risk of cancer. And there were some other foods as well that they call superfoods, such as cinnamon, olive oil, turmeric, flaxseed, and beans, which are high in fiber. So all of those are cancer-fighting foods. Now, L-arginine is also a cancer-fighting substance. It inhibits the growth of cancer cells both in the beginning and in the later stages of cancer. Now, the L-arginine is converted into something called nitric oxide. And nitric oxide is a compound that actually goes around mopping up all the bad cells, or the free radicals as we call it. What happens when cancer starts to invade cells? The cells break apart. And when these cells break apart, it throws off different particles called free radicals. The nitric oxide actually goes and takes up those free radicals and gets it out of the body. So high levels of nitric oxide have been shown to slow cancer proliferation, and it can also keep cancer in a holding position for longer periods, so the body's immune system, once it's boosted, can actually start fighting off the cancer cells as well. And I also wanted to mention that the L-arginine can help in many of the organs. It helps in the intestine to increase digestion. It helps the pancreas in the production of insulin. It also helps with bones. It helps the bones to grow normally. And it also helps with the urinary system. I'm sure Dr. Douglas will talk about this tomorrow, where it helps improve blood flow to the bladder. It also helps to improve urine flow from the kidney. And last but not least, it helps in the circulatory system as well to help prevent hypertension and improve cardiac performance. So thank you. Any questions?
Let's put our hands together for that is a wealth of information. You don't have to pay for that. Okay, a wealth of information. And I'm sure that you're bubbling just to get up and ask a few questions. So I'm going to just raise your hand. There's one there.
Yes, please. Pardon? Say it one more time.
Pardon? Can injury to the breast cause cancer?
Okay, injury to the breast causes something called fat necrosis. When you're punched or hit, the fat cells that I showed before, those can become damaged and it can form a lump. Now, that could be a little tricky because after injury, you might think that you have breast cancer, but the fat necrosis usually goes away after a while. In rare cases, it can turn into cancer. Very, very rare.
Is there any relation between fibroids and cervical cancer?
Okay. Good question. The fibroids are usually located within the womb of itself, within the uterus. Is when the muscle of the womb, for some reason, starts to grow. The cervix is at the neck of the womb. There's no relationship between fibroids and cervical cancer, but fibroids sometimes can picture another type of cancer called, because a fibroid, the real name for fibroid is a leiomyoma. And it can picture something called a leiomyosarcoma. The leiomyoma is benign. Fibroids are benign, but the leiomyosarcoma is cancer. So sometimes when you see persons having the extended tummy because the uterus is growing, like similarly like how a baby will grow, we usually put it down to fibroids, but sometimes you might need to get a biopsy, especially if certain other symptoms are going on, just to make sure it's not the leiomyosarcoma. But there's, as far as I know, there's no relationship between the fibroid and the cervical cancer.
Is cancer contagious?
It's not contagious, but the HPV virus is highly contagious. You can get HPV just from touch, but it's usually sexual contact. Right. She asked after menopause if the likelihood of breast cancer increases. You mean as you get older? With age, just with age, it increases because the tissues in the breasts are going to change. Also, when you go through menopause, the estrogen levels decrease. So there's a lot going on in the body. It does not mean that just because you're going through menopause, you're going to get cancer, but it does increase your risk because a lot of changes are going on.
Because I had heard that because there's no longer the estrogen and the progesterone, that you were even safer when you were going through menopause. That's what I had heard.
Not from my knowledge, because the estrogen levels decrease. It never goes to zero, but the estrogen levels decrease as you're going through menopause. Cancer isn't caused by estrogen or progesterone. The cancer is caused by mutations in the cells. So when you have changes to the body, sometimes the body don't always cope well. So sometimes the changes can cause the cancer, but not necessarily hormones. I hope that explains it. Okay. Yes, please.
Highest for breast cancer, is that correct?
Breast cancer deaths, yes please, in the world.
In the world?
That was the World Health Organization information. So which means, well, we remember they look at population-wise. So our population, the amount of cancer deaths that we have in our population is the third highest.
So what's causing that? Is it the diet, the wrong bra, or what's causing it?
It would be fantastic if we did a study to find out what the cause is. The BNR, which they came about around 2008, 2009, they have started collecting data. So it's about 10 years now that they've started collecting data. They're now going to start channeling research into why certain things are happening, because it's not only cancers that are high. Believe it or not, strokes are high in Barbados. Heart attacks are high in Barbados.
So it's food?
I suspect it's food, because our diet is not the best. Most persons tend to eat fast food, and most persons tend to stay away from the vegetables and the fruits and the ground provisions. They'll eat more processed foods. All of those things.
Macaroni and cheese.
Exactly. Right. All of those things will push you more towards a cancer environment. Because what our bodies were made for fruits and nuts and, water, sunshine. So that's where the New Start comes from. That's what our bodies were made, So when you start changing up, processing foods and doing different things, the body tries its best to take out what elements it can, but sometimes some of the preservatives and so forth get transmitted in the bloodstream, and that is when the confusion starts.
So, we also hear about red meat. How does red meat relate to cancer?
Right. So persons who eat an increased amount of red meat are actually more prone to cancer, especially the colon cancer. So we usually advise persons not to eat the red meat especially. Oh, sorry.
Is there a link between fibrocystic breast and cancer?
Okay, fibrocystic breast disease, that is when the breast tissue, for some reason, has a lot of cysts. A cyst is just a fluid-filled sac. So sometimes, some people have a little cyst here on their hand, That fibrocystic disease is a benign disease, so it's not cancer. But whenever you have any type of irregularities going on in the breast, because it's going to appear like a lump, you should get it checked out to make sure that it's not cancer. But the fibrocystic disease is not cancer.
I would say that I'm having a situation, well, precisely about, there's over 40 years now, I had 2 minor lumps removed from my breast, the right breast. And sometimes they will hurt, it will hurt, and other times it won't. But to be honest, I'm very concerned. When it hurt, I make the doctors miserable.
Fair enough.
Because I understood that my mother had one of her breasts taken off.
Okay, so
I'm not sure, but that's what I understand. Plus, I had a brother who died from colon cancer.
Right. So that puts you at high risk.
Had a great aunt who died from stomach cancer. Can't remember anybody else. But anyway, early up this year, I went to the doctor. First to begin with, I saw a red spot on my left breast. And when I went to the doctor, I showed it to her. And she ordered a mammogram for me. I went and had a mammogram done. And the results from the mammogram stated that there was a mass in the breast, which is the right breast. Right? And it said that I should have further examination by ultrasound.
Okay.
But I had an ultrasound done at the hospital, and I don't know, there was some confusion there because I don't understand it. When the doctor were doing the examination, the doctor showed the nurse. He said to her, well, look, there's a mass in the right breast, but in the left there wasn't any mass. Send up the report. When I went to the doctor now at the polyclinic, the report stated there was nothing.
Okay.
All right? Okay, she ordered another mammogram for me, and I went at the place there in Bay Street, what name?
Cancer Society.
Not Cancer Society, Bayview.
Oh, okay.
Yes. And that showed mass. I guess the mass that was shown maybe were from the 2 scars that I had earlier. Is that a possibility?
Is a possibility, but seeing that you are at very high risk, if I were you, I would ask to be seen by a general surgeon. The general surgeons are the ones who actually deal with the breast cancer, and they will be able to direct you if you need a biopsy of that area to send to the lab to verify if it's cancer or not. So that, from my point of view, that's what I would advise to do.
Okay, and the doctor sent me back now to get another ultrasound. Is that necessary?
I would see the general surgeon first. The problem with ultrasounds is similar to the mammograms, in the young. As you get older, because the tissue is not as dense and as firm, when you do the ultrasound, sometimes it doesn't show it up as good as it should. So my advice would be to get a biopsy done of that area just to verify if it really is or isn't the cancer. Because even if you do the ultrasound, you're still going to need a biopsy anyway.
So if there's any like chances of cancer, do you get pain in your shoulders, neck, whatever, your hands?
Usually, if it's early cancer, we usually say pain. You don't get pain with cancer. Cancer,
well,
unfortunately,
that's what doctors say.
Right. Cancer, unfortunately, is not a painful disease. So you usually get a painless lump.
Okay.
If you go into stage 3 and 4, you can get pain though.
Okay.
So it depends on the stages.
Okay. Thank you.
Okay. My concern is this. Persons work in stressful situations, especially jobs. This stress is a silent killer. Now, if you were born into a family where cancer is hereditary, and then you gone into a job, that is really stressful, don't you think that could be a number one
Risk factor.
more or less factor for cancer?
Yes, it's true. Stress can also cause changes in the body, because you usually get an increase in cortisol levels, and you get some other hormones that come along during the stress response. And as I said, when the body changes or when the body has an influx of different things going on, sometimes the cells can mutate, and that is what causes the cancer.
Because I can tell you that in my area of work, 90% of my staff who died from cancer.
Right.
90%.
Right.
And I know they work in stressful
Environments.
jobs. Some might have been hereditary factors, some might not have been. So I'm saying, should we look at the type of jobs and look and see where we can help these persons?
It depends. There are a lot of things that can cause cancer. So stress alone by itself, yes, is a risk factor, but sometimes the environment you work in. There's some studies that are showing that certain office environments with the different creatures like mold and so forth can also increase your risk of cancer. Also, persons that work in certain jobs are at risk for cancer because of the environment that they're in. So there are a lot of risk factors that can cause the cancer. But yes, stress is one, unfortunately.
I heard you say before that contraceptive pills can be a contribution to breast cancer, and the Caribbean has a lot of breast cancer. Can the people be advised on contraceptive pills before they ramp them down the young people's throat to let them know? Because I can remember working in England, and when patients come to the clinic and they were diagnosed with lumps in the breast, the first thing the doctor would tell them, find another form of contraceptive. Why can't the doctors here let the people know that those are very dangerous and they cause breast cancer?
The oral contraceptive pill, you usually have to use it for many years before the cancer develops. So we usually encourage persons to do pill breaks or contraceptive breaks, because it's not just the pill, believe it or not, the injection, the copper T or the insertion device, uterine device, all of those put you at risk for cancer, unfortunately. Usually the doctor should explain that, you are at risk for this. It usually doesn't happen immediately. So if you take the pill for a couple of years and then decide to take a break for 6 months, your body should actually, the pill changes your entire body, believe it or not. The hormones in there change everything so that you don't get pregnant. So if you take breaks, the body should revert back to normal for a while, and then you can start the process again. So you should take pill breaks. The discussion with the doctor, however, should be your risk versus benefit. So if you know that you practice certain high-risk things and the possibility of you getting pregnant is high and you don't want to get pregnant, then you need to weigh the risk of the pill along with the benefit of not getting pregnant. So usually there's an individual discussion and an individual thought process that has to go along with it.
Okay, we want to thank you for asking your questions. Put your hands together again for Dr. Mandeville. I think that information was good information, and that the ladies as well as the men would, take as important. Now, tomorrow night we'll be at the Western Light Church there in Oxnard, and if they came tonight, don't you think that we should go tomorrow night by then? I mean, that was too soft, If they came by us tonight, don't you think we should go tomorrow night by them? Yes. So we will go tomorrow night by them. And if you know Dr. Duglin, I tell you, he has a wealth of knowledge. And therefore, the men came out tonight, and we want the women to come out tomorrow night. So women, go and make sure and drag your men to Western Light, Oxnard's tomorrow night. On Wednesday morning at 9 p.m. on 100.7 FM, we'll be, I think this month is the month of the elderly, right? Yes. And that was one reason why we put in that radio program, so that, and we know that is very, very important in relation to the elderly and young people, okay? The elderly sometimes have nutritional problems for a number of reasons. The taste as you get older, okay? And also sometimes when they have in the dentures, they have problems, you know, eating food and so forth, and therefore they could very well not benefit from the nutrition as they should. So therefore, if you have elderly parents, you need to at least tune in where the nutritionist, Stacey Whitaker, she'll be speaking on Alzheimer's and the elderly in relation to nutrition. And then on Thursday night, 7 o'clock, we'll be at the Jane Street Methodist Church. And we have 1 or 2 members from the Jane Street Methodist Church. And if they have come here tonight, we should also be by them on Thursday night, where you'll have the panel discussion. You'll have Dr. Duglin, Dr. Hadley Lawrence, and Dr. Edwin Thompson. And I look at the questions, and the questions are really thought-provoking questions. So we expect to have a very dynamic, very exciting panel discussion on Thursday. I'll be giving out another gift tomorrow night, another gift, in fact, 2 gifts I'll be giving out on Thursday night. So even if you come for the gift, still come. Come for the gift, or you'll learn something. All right, so I want to thank all of you for coming, taking up your time. I'm sure you may have had other places that you could have been. So I want to thank you for coming. We really value your presence, and we'll meet you again tomorrow night at Western Light Church there in Oxnard. I want to ask the pastor to come, and he's going to close us off in prayer. Unless, Winston, is there anything else that we need to say? Okay, so we're going to ask the pastor to come, and he's going to close us in prayer. We're going to invite you to